Hi, my name is Yadira Pineda. I'm the PSR coordinator for the Bethany Center, and I've been with the company for 13 years. I like that the whole CHC has a purpose. As of a proud moment, I feel like we're actually living it now because we're coming from a little clinic that was 2 days, 2 half days out of the week, and we were behind a church. I feel like we are growing, and that was like thanks to Dr. Dahlberg. They had a dream, and he would always say, I can feel it, it's gonna grow, it's gonna grow. And we were a little impatient at times, and we're like, we don't see it grow. And then now that we see that we moved to a new location and that we're full-time, so I do feel proud of all of us, what we have accomplished as a team.
My name is Sarah Waldrop. I have been with Carolina Health Centers for 17 years, and I have been at Calhoun Falls Family Practice now for I think 3 or 4 years. Well, they're important because a lot of people, if you don't have insurance, and I didn't realize how many people did not have insurance, how many indigent folks we had around, and how many people who can't afford health care. And so it's much needed because of that, because it gives people a place to go. Because I feel like a lot of people are overlooked if they don't have insurance. So we're there for those who have it and those who don't.
My name is Ulissa Moran. I'm a clinical medical assistant here at Hometown Pediatrics, and I've been here for over a year. Specifically, it's a pleasure to be around beautiful babies and adolescents. It's never a dull moment, and they're precious in their own ways. Effective communication with the children is vital. Here at Hometown Pediatrics, we create a kid-friendly space and communicate on the child's level and use humor to make the experience more enjoyable. A moment that made me proud of being part of Carolina Health Centers is the service and the attention that is not only provided for everybody, but specifically for the Hispanic community. Growing up, I've always translated and guided my parents with their needs, and with the language barrier, it can cause a delay in care and a lot of misunderstanding. But here at Carolina Health Centers, I feel like my community is heard, and that means everything to me, and it makes me feel proud of being part of the Carolina Health Centers.
Hello, my name is Kay Gilchrist. I'm a PSR at Lakeland's Family Practice in Peds. I've been with the company, Carolina Health Center, be 9 years next month. What I love the most about working with Carolina Health Centers is how they love the community. Our biggest goal is to reach out to the community, and since I've been with the company, that's the core of our company, the community. The moment that makes me more proud, it makes me proud and it makes me sad, was during COVID. I seen how upper management on down, when COVID came about, everyone became as one. Upper management would come out, we do the COVID clinics, everybody engaged. It wasn't no one specific person, everybody had a hand in it. And actually, I lost my father to COVID, but actually, I wish I could have had CHC workers who could have been working with my father, because we did an excellent job. Just making sure, patients got everything they needed, was really much like first responders. I enjoy being the front line. I'm the first person, I'm a PSR, so I'm the first face they see when they come in the door. And actually, you build a great communication with the patient. Actually, you become like family, They start addressing you by name, Kay, Ashley, And what I enjoy is our patients. I enjoy listening to their stories, because we deal with a lot of older patients over here at Lakeland's, But I really enjoy just being able to be a listening ear to them, being able to be an advocate for them.
My name is Michaela Roper. I am a registered nurse here at Lakeland's Family Practice and Pediatric Centers. I work on the pediatric side. I've been here for 4 years now, 4 years. I love working with the families, and I love the way that this company overall cares for you as an employee. They always go out of your way to make you feel appreciated. I enjoy getting to know the families and treating those patients like they're my own children. I love helping them out and going the extra mile to make sure that they get everything that they need. We are a great halfway place between either ER in Lawrence or Greenwood. So if patients need us, they call us, we get them in quickly. Even if we don't have room on schedule, we work with them and get them in, and they're seeing the best that we're able to see them.
So my name is Mariella. I work here at LC4 and I've been with the company almost 4 years. I like to translate. There's a lot of patients that have a language barrier, so I am proud of being able to translate for CHC.
I'm Stephen Bradbury. I've been here at Carolina Health Centers for 16 years. I work as Assistant Administrator in the IT department. My role here at CHC is very rewarding for me. I'm able to come in every day, solve problems, and put things back together when they need to be. And knowing that on the back end of everything that I do, it's helping patients and doctors to give care. Just knowing how much effort and work goes into just everything, just from logging into the computer to being able to use Epic, the redundancies we've got in place, the things that we've done on the back end that you don't see, and you know, all the other things that we do, like running cable, just the little things, yeah. To me, community health centers play a very vital role. I was a patient here before I worked here. I saw the amount of people that they helped. And I've seen both sides. I've been to the hospital here, and I've come here as well. The patient care we get here is far beyond what I'm seeing anywhere else.
My name is Lynn Walker from McCormick Family Practice, and I have been with Carolina Health Centers since January 1st, 1980, which is pushing 46 years now. Community health centers are important for our Lakelands regions because we have affordable medical care and we have wonderful providers, and we have a lot of services that we give our patients. I feel like I'm a servant. I love serving people. I love to greet people, and that's kind of my customer service is kind of my thing. And I enjoy the family atmosphere that we have here and treating all family members and just extending that hand of help to them. And any of the supervisors that's over the PSRs, they're all just there when needed. And I think that's just, they all do a super job.
I'm Haven Darnell. I've been with the company for 4.5 years. I work at the Pendergrass Family Health Center location. I'm a patient service representative. What I enjoy the most is not only the people I work with, but the people that come in as patients. I grew up in Ware Shoals, so I see a lot of familiar faces, some new faces, and just really the people and getting to interact with everyone. And if they need help with something, we're always here to help. So it always brings joy to us, especially. We have a lot of elderly patients, so we've gotten close to a few of them. So for the last 2 years, I've got to participate in the Ware Shoals Catfish Festival. I've got to do patient outreach. I'm from Ware Shoals, so I've known about the Catfish Festival for years, but it was nice to get out in the community and have a face from Pendergrass Family Health Center, where most of the local people would come to this office because a lot of people have transportation issues. And that's another thing with being in Ware Shoals, there's not really, unless you have Medicare transportation, to get back and forth to those appointments. So it was nice to get out and tell the community, you know, about not only the provider, but us here as a staff and what we have to offer, and just letting everybody know that we're here.
I'm Ann Magana Frausto. I am a PSR at Ridge Spring Family Practice. We had a patient, I'd only been working here about 6 months. He was a newly diagnosed diabetic, and he thought he was going to have to just die because he could not afford his medications at his original pharmacy. We, told him about CCP, which brought his medication prices down enough to where he's doing great now. So yeah, that's one of the wonderful things about working here at CCP. You guys are amazing. We're more than just the front face. I mean, yeah, we are the front face. We understand that. but there's more to it than just checking in and checking out. We get, or I especially get, a lot of people's backstories. We hear things, we hear people's life stories sometimes. It's harder than it looks. I like being able to make a difference in, my personal passion is migrant workers. So working with CHC, and especially here in Ridge Spring, I get to make a difference and bring healthcare to people who wouldn't get healthcare without us, really.
My name is Sara Jaramillo. I'm a PSR at the Saluda office, and I've been here with the company for 17 years. What I like most in my role is that I get to translate with our patients and so they can understand more when they come to their office visits. What I like most of working here at the company is that I'm able to help our community and mainly our Hispanic community.
So my name is Harmon Deary. I'm the PSR coordinator here at the Children's Center, and I've been here for 6 years. People don't realize all the resources that we have available here for the patients. I enjoy most seeing all the cute babies come in.
As far as what people mostly don't understand or know is that we offer more than just primary care. We offer behavioral health, women's health, substance use. We can do a sliding fee scale for some of our underinsured or uninsured patients. Since a lot of the Carolina Health Center's community, we see a lot of the underinsured patients. So in the rural community that most of our locations are, it's very beneficial for a lot of people that may not realize I can have a primary care provider even if I don't have the proper insurance or insurance at all.
My name is Sarah. I've been working here for 5 years and 8 months as a patient service representative at Uptown Family Practice. I love how we serve a lot of uninsured patients or patients that can't afford health care, but we're able to do that with the resources we do give out for patients. What I love the most about my role is I also translate, so I'm able to help patients that don't speak English. I feel like it really does help them out a lot, just because at other offices you don't really have translators, so that's what I love about my job the most. What I wish people knew more about is how we help with patients or females that don't have insurance. We do have a BCN program that helps cover that, and I feel like not a lot of people know about that. Also, for patients with drug abuse, alcohol abuse, we do have things that do help those patients out. That's something I wish they knew about too. I feel like most people don't know how many resources we have. There's resources for like people who don't have food, shelter. We have resources for everyone and everything.
In general, working at Carolina Health Centers feels like family. It's not just about the numbers, but we as employees are cared for, and the company itself provides great benefits for their employees.
I don't feel like people know that we really are a family. We're family, like, not only are we family employees together, but we consider the patients to be part of our family. You get to know people, and so we don't do it just for a paycheck. We do it for the relationships and for the interaction. And I like community service. I like being with the community and being with the people and talking with the people, because a lot of people need that and they don't realize that we're not just a doctor's office. We're a home.
Hi, my name is Valerie Moore. I've been with Carolina Health Centers, let's say 26 years. It's been a long ride. My title at Carolina Health Centers is IT Communications and User Experience Specialist. What do I love most? Let's see, one of the top things I love most about working at Carolina Centers is the people, my coworkers. We're like family. We help each other out. We gather as a team. We work individually. We check on each other. It's always been that way since day one. Carolina Health Centers is so important to the Lakelands region. There are so many populations that just do not have access to care. And at Carolina Health Centers, we offer so many types of care that many people do not know about. I can just name a few: behavioral health, substance abuse counseling, HIV/AIDS support, women's health, senior health, family medicine, pediatrics, substance abuse counseling, just to name a few things. Most people do not realize that we do not only see you in the office, provide you with a prescription, or send you for a referral. We treat the whole person. So that covers, your mental health, not just your physical health, your sustainability for home life. There are so many things that treat the whole person. Do you have anything to eat? How did you come to this appointment? Can you get to your next appointment? So that's some of the things that I think that Carolina Health Centers goes above and beyond to provide for the patient.
Well, our support staff is awesome. IT is wonderful, I don't know what we'd do without them because, it's very critical to have our computers up and running.
Okay, what I wish most people knew about support staff, one of the biggest things around our region is overdose, that our pharmacy do give out Narcan for free, and how the Jessica Jacob, how she keep us informed how many ODs we had, keep us in the loop, and so therefore we get to let others know that, hey, you go to Carolina Pharmacy and get you some free Narcan. And also what I like about is our quality department, how they have came out with the food bags, So therefore, we keep food bags here at the center in case someone's hungry or have to go without, they don't have to leave here empty-handed.
Community health centers in the Lakeland regions are important because it's all inclusive. We service all people regardless of their status.
We are Carolina Health Centers. Care you can count on, people you can trust.